All right, we're going to start session 2. My name is Rebecca Christofferson. I'm from Louisiana State University, and this is my 3rd year here. It's always fun. Glad to see some new people and the people I see every year. I have the honor of chairing this session. How did we end up here? What are the drivers for the most recent global dengue surge? So first we have Dr. Henrik Salje from Cambridge University. He's going to sort of talk about the ghost of dengue near past and present. And then Dr. Catherine Anderson, who's here at SUNY Upstate, but also with the County Health Department, and she's going to talk about the ghost of dengue future. So with that, Dr.
Great, thank you very much. I also will stray into the future. So I had grand plans for this presentation to look at all the different hypotheses which might be explaining some of the massive increases that we saw in the previous session. I had to scale that back given the time, and I'm going to focus on probably one sort of obvious one and maybe one slightly less obvious one, which is contributing to the significant levels of dengue cases and deaths actually that we are seeing around the world. So I'm not going to, given what we've seen so far, there's clearly been a massive uptick in dengue over the last couple of years, and the question is really, well, what is driving this? And I think there's been a lot of interest. We've heard it already a few times about the role of weather, of climate, and I show this picture a lot when I give talks. This is work a few years ago now, about 10 years ago, from Willem van Penhus at Pittsburgh, which in the top row is, the top left panel is simply taking data from across Southeast Asian countries where each row is a different district, and just simply counting or showing the number of cases you see in over time, where red is always bad, blue is not bad, and so what you see is there's this huge synchrony across Southeast Asia, where you just have these big epidemics that are correlated across the whole region. And at the bottom rows, you have temperature on the left and precipitation on the right, and that correlates very well in the red, where you have these big El Nino years where the temperature really does change. So we know that there is certainly this importance there. I mean, when you try to actually link explicitly temperature and rainfall to dengue incidence, that gets a little bit linear and complex, but there is certainly the strong association in general. More recently, there's been work by Yung Cheng and others showing that this index, which measures the level of temperature and other things in the Indian Ocean basin, this IOBW index, seems to be highly predictive of dengue incidence across the world as well, and showing really this is relevant for both northern hemisphere and southern hemisphere parts of the world, both in terms of being able to predict the timing of outbreaks and also the size of outbreaks. So we're getting this signal, okay, right, there is this role of temperature, and there's been some work as well, just in medRxiv from Marissa Childs, showing that actually you can even start trying to attribute the level of the amount of dengue back to how temperatures have changed over the last 10, 20, 30 years, and showing actually for many parts of the world you can attribute a certain amount to differences in climate. So mechanistically, how is this happening? Well, it's really, you've got to ultimately look at the vector, and it's really where you have the vector is you need to have the vector to facilitate and have transmission. And here on the right, work by Moritz Kramer, who brought together these different climate indicators of population density, land use, temperature, rainfall, and then looked at where you found Aedes mosquitoes and built these predictive maps. Now, it's very easy to build beautiful maps, but you've got to have a little bit of skepticism on whether the maps are actually useful in telling you anything which is actually informative of dengue or other risks. So I've always been a little bit of a skeptic these things, but actually what we did is with chikungunya. It's a little step away from dengue to chikungunya, where we just looked around the world and looked at countries that have or have not ever reported chikungunya, very simple measure. And actually these maps, when we look at your level of Aedes in a particular country, as your x-axis there is the figure at the bottom, and why your probability of having an outbreak in that place, there is a beautiful association, which was not at all what we expected. So these maps aren't nonsense. They actually are. There is some information there. More recently, Sadie Ryan in Florida has actually thought about this a slightly different way. Rather than just the probability of presence of these mosquitoes, actually, let's also, climate change can also be changing the seasonality of these mosquitoes. The number of months in a year you have adult mosquitoes in the population. And actually, if you use these separate maps, actually you get ultimately exactly the same association, which is comforting. On a more local level, we've done quite a lot of work in chikungunya, actually, in Bangladesh with dengue. This was actually referenced earlier, where we did a seroprevalence study around the country. And actually, if we look on a local level, the predicted level of Aedes in that place and the seroprevalence of dengue in that place, again, you see a very nice association. So actually, these markers of mosquitoes are useful in telling us actually these are linked to risk in some way. What does this mean going forward? I said I am going to stray a little bit into what Kate will discuss a bit. And so this is work from that same paper in Sadie Ryan, where the top row you have Aedes aegypti on the left, Aedes albopictus in the middle there, and so that's the current distribution. And then under two different climate change scenarios to 2050, one more optimistic, one more pessimistic. And you'll notice they look very, very similar to each other. And actually, there have been a few efforts to predict the future distribution of Aedes, and they kind of always come to the same conclusion. The maps always look very, very similar to each other and similar to today. And on the top right, what we try to do is actually quantify by country the size of the population at risk, and that's at the top right. And then in the middle on the right is then what the change in the size of the population at risk under these two different scenarios. And actually, the expansion you see is really in the northern. You have more red up north, or red bad, more red down south. So it's really expansion into new geographies. And actually, some parts of the middle of the world, you're actually going to get predicted reductions in dengue risk. Simply, it's getting too hot in some of these places. More explicitly, you can actually quantify the change in chick cases in 2050 versus today. And actually, this is with chikungunya because we've actually done the work, but you can imagine this would be similar for dengue. Globally, you would expect 2050 versus today as sort of a modest increase, like 4%. But all that increase is going to be in sort of places going further north, so Europe and North America, we get very large increases. And then many parts of the world, actually, it's going to be pretty flat. You're essentially at a place where you have near to saturation in your level of mosquitoes, and might not be completely there. We saw in the earlier presentations, actually, the expansion in Brazil has been places going further south, with Sao Paulo State. So you're getting further and further south. At some point, you're going to reach all of Brazil. Bangladesh historically has really only had proper transmissions since 2000, and now we are. So at that point in 2015, we did our study. Only a quarter of the country have ever been exposed. So these are new geographies which are really getting the burden. But at some point, they will have experienced a lot of dengue, and there'll be a lot of immunity in the populations. The burden will certainly, so whilst you get the expansion in mainly Europe, North America, actually, when you look at the actual distribution of the population where it's at risk, will remain very much places like Asia, Africa, and South America. So that's the first part. The second part is something which has been my little area of interest more recently. It's really thinking more carefully about demography and how as a population we are changing, and what the implications for that are for infectious diseases, including dengue. So this is just looking at fertility in Thailand. This is work by Megan O'Driscoll, who really showing how the number of births by age has been changing quite drastically. And this is from Thailand, but this could be replicated in many parts of the world. Thailand, we were chatting yesterday, it's lost like 1 million people recently just by reducing birth rates. And so, what does this mean? So you're getting fewer and fewer births each year. So actually, when you have fewer and fewer births, you have fewer and fewer susceptible people born into population. That's fewer and fewer people that are there susceptible, we're ready to be infected. And that has a direct impact on your probability of infection, what we think about as the force of infection. And so this is looking at the force of infection for dengue going from the 1980s to today. It's work by Ankana Huang demonstrating that there's been this massive drop-off. There's been a bit of work as well from other people, including in this room, in this area. That's a good thing, right? We're reducing the probability of infection, right? And this is all in the face of all this climate change. I mean, Thailand is not immune to climate change, but actually the probability of infection in Thailand has been going down hugely. The number of infections has been going down. Reducing infection risk increases the age of infection, though. So what this means is by having fewer and fewer susceptible, you're actually, when you're getting infected, it's happening early, it's happening later and later in life. Historically, dengue was always seen as this pediatric disease, right? They didn't even bother thinking about dengue in adults in large parts of Asia. It's really what happened in kids. But now that's changing. The mean age of infection mean age of DHF now is well into the 20s. So much older than it was historically. And infection later in life is a problem. Right? It really does change your probability of having a severe outcome. This is work I did with Jess Metcalf, where on the back of COVID, we initially, and then we all saw there's this huge effect of differences in risk of death by age. So that's COVID is in red here, and this is what we've done here. We've just compared to 60-year-olds. So what is your probability of death given infection relative to a 6-year-old? And going from 10-year-old is like the best age to be. Like you are not going to get severely sick. You're in a good place there. Up to like an 8-year-old, it's 10,000 times different in your risk of disease, of death. And I've shown death here because often the easiest, cleanest data to look at, but we have similar data looking at severe disease, including ICU. I've just then on the right put it on an unlogged scale just to really hammer home this huge effect of age and probability of severe disease. And we've repeated this with, so we've got COVID there, we've got MERS, SARS, flu, and actually even all-cause mortality really follows the same characteristic shape, especially once you hit 30 to 40. And you can actually quantify it and say, actually, each year of life, you are 10% more likely to die from that thing as compared to had you got infected last year, right? And sometimes some of these, and it's nice to compare to a 60-year-old because some of these, the underlying absolute level of death is very, very low. And some of them are higher, but it seems whatever it is you're looking at, you're 10% more likely to die from that thing if you get infected once you're an adult. 10-year-olds are safe, all right? And actually, we have now been able to, it's always been very difficult to look at this for dengue because dengue has this horrible problem of immunity, which means actually all these endemic populations have been saved, they've been safe, these elderly people have been safe because they were infected as kids, they're safe, they can't get infected. But actually Bangladesh was a nice opportunity to actually really look at the underlying probability of death from dengue, at least on a relative perspective, because they only had proper transmission from 2000. So it means that all the older people had the same cumulative probability of having primary infection and so on. So we could really get back out this, especially for these older individuals. And it follows essentially exactly the same pattern. Chikungunya, actually I've written Brazil there, but it's actually from Paraguay, where on the back of the Paraguay outbreak in 2023, we went in to supported by CEPI, work by Gabriel dos Santos, who's here, showing where we did a seroprevalence at the end, so you could see actually the underlying attack rate. You had well-recorded deaths, and you see exactly the same thing. 10%, and it's exactly, the number we get is exactly 10%. 10% more likely to die from chikungunya this year compared to last year. So it seems to be, and I think there are many talented immunologists here, immunity seems to be the underlying thing here, which is driving this pattern. So, what does this mean? So the global population is aging. And so here on the left, I've just overlaid the mean age of the world population, I think, is something like 30. I forget the exact number, something like 30, and by 2050, it's going to be something like 36. So you think, okay, that's a small increase. So I thought, okay, what actually are the implications for this? So I've decided to look specifically at Brazil. So in black there, you have the age distribution today of the Brazilian population. As red is the projected age distribution based on current birth rates, created by the World Bank, I think. And you see really this aging population. So what we can do is we can actually build simple, these are called catalytic models, but they're just simple mathematical models which can actually reconstruct the underlying level of immunity in a population, the number of annual deaths, and the number of infections in a population, and allowing us to actually just have a rough estimate of actually, using the age distribution of what we see in Brazil. Let's say we have, let's just pretend that the age structure is suddenly shifted to 2050. We're going to forget about any reductions through this birth rate issue. We're just going to look at differences in the underlying age structure of Brazil. And that would result in more than 50% increase in the number of deaths you would see in Brazil. So just that change in age structure, just having an older population, is pushing you along from the left to right in that log linear increase. So that's one. Two, if we then think, actually, let's look at Hat Ankanohang's picture of the reducing force of infection and keep going forward. Let's just have a small ongoing increase. This is ultimately this thing we're trying to do often with our intervention. We're trying to reduce the underlying force of infection through Wolbachia, through vaccines. Let's pretend for birth rates or maybe some of these other things, we end up with a 20% reduction. That reducing force of infection is again going to actually increase the number of deaths we're going to see in our population, and get a similar level, around 50%. And when you put the two together, you actually get more than double the impact. You get, it's more than just a simple additive effect. These are really things we need to be considering going forward. I'm going to finish up. There are dirty little secrets for these things. These are very simple toy models, but I think they do give us an indication of some of the things we want to be thinking about. So it is only by reducing the force of infection by 99% that you can actually mitigate these increasing risks. Again, it's a very toy model. It's just giving us an idea of some of these impacts, the changing age structure, reducing force of infection, what you might see in severe disease outcomes. But it's saying that we actually need to be massively reducing the force of infection in this kind of scenario. Now, going back to what Alan was saying, in terms of what we want to, in our end game, maybe we don't want to be winning the infection chess game. We want to be winning we don't want to get rid of dengue, maybe, because I think that is potentially dangerous. In fact, what we need to be doing is the severe outcomes. We need to be making sure we don't have reduce the risk of these severe outcomes through whatever means. I always like to have these local drinks. This is a Syracuse beer. I managed to. Actually, I had some last night. Although it's mirrored. So if I was going to just put my beer on what I think is most important today, what is most important in 2050, I think expanding mosquito populations, it is clearly relevant. I think on an annual basis, when you have these big years like we've seen in the last 2 years, it is a huge problem. When you look on an average basis over many years, if you saw that initial picture I showed from Willem's paper, when you have these big years, you're followed by a lot of immunity in the population. You run out of susceptibles, and then you sort of have a lower year. So on an average basis, that gets sort of evened out a bit. And I think that importance is going to go down as we end up with full saturation globally of where you're going to have mosquitoes. The aging population is reducing force of infection for whatever reason is going to be a massive issue going forward. I think something we need to think about very, very carefully. So this is just really summarized to say that yeah, the increasing temperatures is expanding this footprint, but it's to the north and to the south. The rest of the world is going to be largely saturated. If anything, it might even go down a bit, but it's really this aging population. And just thinking carefully about how if we want to be reducing the force of infection that much, or at least be cognizant of the potential implications of that. I'll just finish there. Just, thanks. I mean, most of this wasn't my work, but it's been great working with the people up in Cambridge and Jess Metcalf on parts of this as well. Thank you. Seven seconds to go.